Hi, my name is Mike Pishvine. I'm an associate professor in the Department of Hematology Oncology at Johns Hopkins University School of Medicine. And I'm here to talk to you today about emerging biomarkers and targeted therapies in gastrointestinal cancers, and really to talk about the need to do biomarker testing for this patient population. We're going to start by talking about the clinical relevance of certain targeted therapies for gastric and gastroesophageal cancers. And really what led the way in this field was targeting HER2 amplifications with trastuzumab. This was based on the TOGA study, which was published in 2010. It was a nearly 600 patient study, and patients with metastatic or advanced gastric and gastroesophageal cancers that were overexpressing HER2 were randomized to receive chemotherapy with platinum and chemotherapy plus trastuzumab. And the trastuzumab led to a significant improvement in overall survival, 13.8 months versus 11.1 months, and an improvement in the objective response rate, 47 versus 35%. This led to the next several years of unfortunately failed studies in the second and third line setting with different HER2 targeted therapies until the Destiny Gastric 01 study, which was a study of the antibody drug conjugate TDXD or trastuzumab deruxtecan, and that was compared to standard of care chemotherapy in patients with metastatic or advanced gastric and gastroesophageal cancers that had progressed on 2 or more previous lines of therapy. And the TDXD led to a significant improvement in overall survival, 12.5 versus 8.4 months, and a very significant improvement in objective response rate of 51% versus 14%. However, this does have to be balanced with the roughly 10% interstitial lung disease that we've seen with the TDXD, but it certainly paved the way for other targeted therapies targeting HER2 in gastric and gastroesophageal cancers. Perhaps the most exciting data in this patient population has been most recently by Dr. Janjigian, who published a phase 2 study of the combination of platinum, fluoropyrimidine, trastuzumab, and also pembrolizumab for patients with HER2 amplified gastric and gastroesophageal cancers. And remarkably, in her patient population, there was a disease control rate of 100%, an objective response rate of 91%, and a median overall survival of 27 months, really the best that has been seen to date in this patient population. This data does have to be validated in a randomized phase 3 study, which is actually ongoing, but it has made its way into the NCCN guidelines, so it could be used even today. This brings us to the second important targeted therapy in gastric and gastroesophageal cancers, which are the immune checkpoint inhibitors. We've known for years that for MSI-high cancers, that pembrolizumab is effective and really has received this disease non-specific approval for any cancer that is MSI-high. But this has certainly been proven true in gastric and gastroesophageal cancers as well in subgroup analyses of Keynote 59, 61, and 62, where pembrolizumab definitely showed benefit in first, second, and third line patient populations. But what about for the microsatellite stable patient population? Is there any benefit for immune checkpoint inhibitors there? Well, we know from the Checkpoint 649 study that the addition of nivolumab to standard chemotherapy for metastatic or advanced gastric and gastroesophageal cancers, that there is an improvement in median overall survival with the addition of the immune checkpoint inhibitor. However, there's been a big debate about this study because the study design did not call for any restrictions on who could enroll with regards to CPS expression or PD-L1 expression. But in fact, it was the subgroup analyses that demonstrated that the patients that did the best, those that received the most benefit from the addition of nivolumab, were those whose tumors were CPS 5 or greater. So the question does raise, do we give them to all patients the way the study was designed, or do we give nivolumab to only the CPS 5 or greater patient population? And that's one that we still don't know the definitive answer to. But it does really raise the awareness of the need to do biomarker testing for not just gastric and gastroesophageal cancers, but quite frankly, all gastrointestinal cancers, because these therapies that are targeted to specific biomarkers can really make a significant impact, as we've just discussed, for HER2 and immune checkpoint targeted therapy.